Mitral valve stenosis is a commonly lesion during rheumatic heart disease. Uh, Cardiovascular disease in pregnancy is one of the leading cause of the maternal deaths in the developing country. So majority women die, pregnant women die because of undiagnosed of the cardiac disease. Alright. So about the history, the important history, we must ask any cardiac event prior to pregnancy, for example like acute pulmonary edema, transient ischemic attack, any arrhythmia, and any recent acute coronary syndromes. And then we required to ask about is need to obtain the information about any surgical intervention prior to the pregnancy, for example like mitral valve replacement, in which we need to obtain about the history about the surgical. Is it patient on the mechanical or prosthetic valve, because in the mechanical it increase risk of thromboembolisms, so the patient may require any anticoagulant like warfarin, which mean warfarin is a teratogenic to baby. Okay, it's a cause warfarin embryonopathy. And then about the bioprosthetic valve, it need not require any anticoagulant, but high risk of failure during the pregnancy. Okay. So about the history of medication history, teratogenic medication history, for example warfarin, ACE inhibitor, ARB inhibitor is important information, right? Pre-pregnancy care counseling is important before pregnancy. Need to emphasize any risk of during the pregnancy. So during the pre-pregnancy care, we will score the patient by Carpet study or Zahara score, right, to predict the maternal mortality during the pregnancy. So during the assessment, we need to assess the any heart failure symptoms, like example dyspnea, autopnea, reduced effort tolerance, and any palpitation history, any palpitation symptoms. Okay. NYHA classification is important to assess the disability of physical function. Okay. Right. So because the patient in the mitral valve stenosis is rapidly and easily deteriorate and rapidly develop acute pulmonary edema. So from the physical examination, we may look the any mitral fascias and cold periphery. So manual BP and manual pulse rate need to assess by us, right? So to look any regularity of the rhythms and the rhythms itself. Is it tachycardic or irregular rhythms? Because increase of maternal tachycardic is one sign of cardiac decompositions. Okay, so loud S1, S2, and mid diastolic murmur. Alright, diastolic murmur and opening snap is the auscultation sign of the mitral stenosis. So we must heard any acute pulmonary edema signs like the crepitation, any crackle crepitation. Okay. Alright, investigation. The gold standard investigation is the echo, right? So echo to assess the mitral valve area. So for moderate, the size is about 1 to 1.5 centimeters square, and then for severe, less than 1 centimeter square. Alright, so it must be highlighted during the management. For severe, we need severe and moderate, we need monthly echo during the combined clinic. Alright, and then also it advocated to look at ejection fraction, to look at the left ventricular function. Okay, the baseline ECG is important to look out any atrial fibrillation or atrial flutter. So ultrasound examination is important to look the fetal growth restriction punya signs, to look any fetal biometry, amniotic fluid volumes, and Doppler. So at the same time, detailed scan is required for women who are exposed in teratogenic drug. Fetal cardiac anomaly by a cardiac specialist, cardiologist specialist, can be done during 22 to 24 weeks. Okay, it's a multidisciplinary approach. Management is a multidisciplinary approach which involves